purpose of the AI and Health Hub is to create a community of multidisciplinary researchers who can come together to talk about questions that are beyond the conventional or usual partnerships that happen between computer scientists and physicians or other healthcare professions, to invite people from the arts, the School of Business. We hope that those conversations impact us beyond what the purpose of the research is, to ask questions about the ethics and implementation in a broad, multidisciplinary conversation.
AI, it's math, stats, and computers. The paradigm shift is the fact that people are realizing that these things can just be applied to a whole range of different practical approaches across a bunch of different domains, making nurses, doctors, physicians, making their lives easier, more efficient, automating some of the stuff that's taking the most of their time.
There are many AI solutions that have been put out by various universities and private companies, but they very rarely have any of them actually been deployed in healthcare. Really, the idea is to take those technologies, take those innovations, and actually embed them in the health system.
As AI technologies are being used in healthcare, well, they are affecting the experience of patients, the experience of nurses and other healthcare providers.
AI has been a big part of our research. It is helping patients, particularly children with heart disease. There's been a positive reception of the work that we do.
I think that AI has a lot of potential to help out patients. I mean, you could think about all the inefficiencies you deal with in a system. You see a physician for 10 minutes. You don't realize that after that, they maybe have to do 5 or 7 minutes of documentation for every visit. In a given shift, their burden of their documentation is much lower. And basically, they're just having much better encounters and much better visits with their patients.
One of the areas that I deal with very much is imaging of the heart. We take a scan of the patient, highlight the areas that we're interested in, and use that to make a 3D replica of the heart. People are much more able to see what's going on with the heart.
Alberta is a pretty amazing place in many ways. We are, top 5 in the world for artificial intelligence research.
AMI is one of the 3 national centers of excellence in AI and ML, and it's located right here in Edmonton. It benefits Canada, it benefits Edmonton, it benefits our partners.
The University of Alberta is poised to be a global leader in the space of artificial intelligence and health. The population-based data that we have are globally renowned expertise in artificial intelligence research. We have a very strong team of health services researchers across this province who have been really working closely with the health system to improve care for Albertans.
The development of this AI and Health Research Hub is important because it will provide space for all kinds of collaborations so that we can ask questions. We can also provide answers that are more meaningful.
There is no question that the future of healthcare will include artificial intelligence across all health disciplines and across the health system.
The AI and Health Hub will positively impact the future of healthcare delivery.